Hello guys, so I get this question most often: normal delivery and cesarean section, which is better? And if I'm to do normal delivery, can my body handle the pain? And how long will my labor be? As a mother of two who has undergone two cesarean sections with a little bit of research, here is my take on it. So hi guys, welcome back. So let's look at the two. What is a normal delivery? Normal delivery is a process by which the baby is delivered through the normal vaginal opening. So the cesarean section is a process by which the baby is delivered after an incision is made on the abdomen and also on the uterus. So the baby is delivered through that incision. Okay. Yeah. So let's look at some of the reasons why a cesarean section would be needed. So we have two types of cesarean section. We have the elective and also the emergency. Okay, elective cesarean section means that it's planned. Okay, delivery is planned before labor. So before a woman gets into labor, you and your doctor will plan the date for the cesarean section. So meaning that all the causes or the reasons for this is agreed on between you and your doctor. So you plan the date for it. So it's planned. So that if with the elective cesarean section, it's planned. You know the date and everything. But with the emergency one, you and your doctor plan for a normal delivery. But because of one or two reasons, at the point of delivery, we have to. The doctor would have to take a decision that no, this baby needs to be delivered through the cesarean section. So immediately the mother is prepared for surgery, and it's not planned. So with the elective, it's planned. With the emergency, it's not planned. Okay, so let's look at the reasons for an elective cesarean section. The first reason for an elective cesarean section is when the baby is too big or the mother's pelvis is very small for the baby. Okay, so that's one reason. When the baby is very big, the doctor will advise that, my dear, you cannot give birth. When you give birth, you hurt yourself or the baby. So please, let's do an elective C-section. So another reason for an elective cesarean section is a low-lying placenta. So what's a placenta? A placenta is an organ that connects the baby to the mother, and obviously it provides blood to the baby. So normally it's not supposed to be low-lying. It's supposed to be at the top. Okay, if it's low-lying, it causes a lot of issues. So in my case, in my first pregnancy, I had a very low-lying placenta, so it causes a lot of bleeding. So when you have a low-lying placenta, the doctor will advise that you do an elective cesarean section, because one, you're already bleeding throughout the pregnancy, and also after the point of delivery, the placenta can detach from the baby and you can lose so much blood, and the result is a no. So when you have a low-lying placenta, the doctor will advise that you should have an elective cesarean section. Okay. So another reason for an elective cesarean section is the abnormal positions of the baby. So it can breech, transverse, or other positions. Okay, baby's position is termed as breech if baby's head is around the chest of the mother. On a normal, the baby's head is supposed to be downwards and the legs are up. With a transverse position, on a normal, the baby is supposed to be on a vertical position. But if it's on a horizontal position, meaning that it's transverse, and the doctor will advise that you should be prepared for an elective cesarean section. With other positions like brow positions, meaning that the baby is in a vertical position, all right, which is in a normal position, all right, the head is down, all right, but it's coming with its eyebrows first. So I see it's coming with the eyebrow first, okay, instead of maybe the head. So another reason for an elective cesarean section is when the mother has previously done 2 or more cesarean sections. Okay, so like in my case, my next baby, it will be an automatic cesarean section. That will be the advice from the doctor, because I've already had 2 cesarean sections. So if the mother has already had 2 cesarean sections in the past, you'll be advised that, my guy, please, let's go again. Let's go through the cesarean section again. So this one, it's planned, it's elective. We all know the time and the date. I'll just carry my bag and come and lie down. It's not emergency. Okay. But another reason for an elective cesarean section is when the mother has maybe a severe infection. Okay, so maybe you have some infection that they are treating, and it's not really improving, okay, and it's very severe that if you go through normal delivery, the baby might contact that infection. So you are advised that, my dear, sleep and let's remove the baby for you, JJ. Otherwise, the baby might contact this infection. So this is also another cause for an elective cesarean section. Or the last on my list is when the mother has undergone some surgeries in the womb, okay, some surgeries like fibroid removal. So because of this fibroid removal and then this surgery that has gone on, doctor might advise that, my dear, let's do a cesarean section because you've done some mature surgeries in the past. Okay, good. So now let's look at emergency cesarean section. So emergency cesarean section is when the doctor has already made a decision that we are going to do normal labor, but because of one or two reasons, the doctor has to take a quick decision that no, we need to rush you to the theater to do an emergency cesarean section. So now let's look at some of the reasons that would require that the doctor would take such decisions. Okay, so the first one is fetal distress, when the baby's heartbeat suddenly drops. So during normal delivery, everything is going on very well, but the doctor would detect that no, the baby's heartbeat is dropping, or there's some changes happening in the baby's heartbeat. This will require for an emergency C-section. That one is very fast. They have to do it very fast so that you can save the life of the baby. Second reason also is that when the baby poops in the uterus, okay, so on a normal day the baby is not supposed to poop, okay, so once the baby poops, then there is an issue. The baby needs to be taken out very fast, okay, so this will also require for an emergency cesarean section. So another reason, despite long progress of labor, despite everything that is going on, the baby refuses to come down. The baby is saying, no mom, I am not coming down. Okay, so this is called non-progress of labor. So with this quick, the mother has to be rushed for an emergency C-section. Another reason too is that when the mother has high blood pressure, okay, the mother's pressure is beyond normal rates, okay, the mother has to be rushed to the theater. Because high blood pressure, my dear, it's very serious. Okay, again, another reason for an emergency C-section, okay, is also when the mother starts bleeding profusely. Okay, so during delivery, the mother starts oozing out blood. The blood is just too much. The mother will be rushed for an emergency C-section. Okay, so now here comes the big question: which is better, a cesarean section or a normal delivery? I'll put it this way: I would prefer anything normal. I would prefer anything normal over something that is not so normal. I'm not saying cesarean section is not good, but if you have a valid reason to go through a cesarean section, my dear, it is fine. Okay, but if everything is fine, please go for a normal reason. I will choose normal delivery over a cesarean section. Okay, if you have a valid medical reason, it's better to have a cesarean section than a compromised baby or mother. Okay, so now normal delivery has some advantages to the mother and also to the baby. So let's look at those advantages. Okay, number one is lesser blood loss. The cesarean section is a major surgery, it's a major abdominal surgery, and a lot of blood is lost. With normal delivery, your baby comes out, the blood that is lost is just few and it's not that much. So with normal delivery, the blood that is lost is less. Second is lesser post-delivery pain. My dear, I learned that the normal delivery, you go through pains, but once the baby is out, your pain disappears with it. But with CS or cesarean section, oh my God, the pain after the surgery is too much. It's too much, please. It's too much. So the pain management for normal delivery is good. With the normal delivery too, the recovery is fast. Once the baby is out, my dear, just minor recovery. But with the cesarean section, you have to go through a whole lot of recovery process, okay? Because sister, yeah, the sick kind HR, and it needs to be treated. So you have to go through recovery process, okay? With cesarean section, you have to really go through recovery process. Yeah, lesser anesthesia complications, my dear. The two cesareans that I've gone through, the back pain, it leaves you with a severe back pain. Your back, it leaves you with this back pain that it's not even going away. It's not. I learned it to go away with its time, but my dear, I'm going through pain, back pain. Okay, certain positions that you can do and feel free and do. Some of the positions you do, you feel pain at your back. Like once you bend too much or you do this, you feel pains at your back. Okay, and another advantage of the normal delivery over cesarean section is that the infection rate is very low. Okay, once you give birth, you are done. You don't have any open cuts that can contact any infection. Okay, so the infection rate is low compared to the cesarean section. Okay, you give birth to the baby through normal delivery, the baby gets some advantages. Okay, so one, because the vagina is tight and the baby is squeezed through the vaginal canal, the water in the lungs of the baby is squeezed out. Okay, so it helps baby to breathe very well. With the cesarean section, you realize that after baby is delivered, the nurses are just taking out a lot of fluids from the baby's nose, ears and stuff, so that the baby can breathe, so that the water can come out of the lungs. Okay, so with normal delivery, water comes out automatically, because Charlie squeezing after baby no more, all the water comes out, so the baby is able to breathe easily. Okay, the normal delivery too, once the baby is born, it improves the gut immunity of the baby. Okay, so the gut immunity of the baby is improved with normal delivery over cesarean section. Okay, so ending this, okay, normal delivery is better than a cesarean section, unless of course you have a valid medical reason. Please always go in for a normal delivery. So again, somebody will ask that, what can I do to have a normal delivery? Okay, there are a number of things that you need to do. You need to follow. They are not difficult, just go through them. Okay, just follow them, just go through them to have a normal delivery. So the first one on my list is good antenatal care. Immediately you find out that you are pregnant, please go and meet your doctor and then start taking advices and stuff from the doctor. The next on my list, eat well. Eat well, avoid a lot of calories, and eat healthy. Eat well and healthy. If you have diabetes or high blood pressure, meet your doctor so that you can see how best you can control it. Again, exercise daily. If you can exercise from 15 minutes to 30 minutes, please exercise daily so that you can be fit. Also, remain physically fit. Okay, make sure that you walk around all the time. Don't just remain at one place, just walk around. Make sure that you are physically fit. Okay, you can also enroll in yoga class, okay, or an antenatal class. There are a lot of antenatal classes that you can learn a lot of things. It will teach you a whole lot about pregnancy and how to handle your baby when your baby comes out. So these are some final words. Okay, number one, don't worry about labor pains too much. Okay, there are a lot of medications now that can curb these pains. There's epidural, just discuss with your doctor. The doctor can have a meeting with you with this anesthetics, and they can advise you on a lot of pain management medications that can help labor. Okay. Also, learn about some breathing techniques. Okay, like go online, you can check about how to breathe during labor. There are a lot of breathing techniques that you can also learn online so that your labor can go on smoothly. Also, don't underestimate this labor partners. Okay, labor partner can be your husband, your mother-in-law, your mother, anybody that you feel comfortable with around you. Okay, it will shock you how it can go a long way, because it can help you emotionally. In fact, I wanted my husband to be around. Because it looks like the room is filled with strangers. Sorry, it looks like the room is filled with strangers, but when I see the face of somebody I'm close to, it helps me mentally. So a birthing partner, okay, is very important. When you are in labor, just make sure that somebody is beside you that you trust, somebody is beside you that you can hold on to emotionally. And most importantly, trust your body. Your body knows how to give birth your body knows how to do its job. Like how you got pregnant, you didn't know. Like you knew what you did to get pregnant, but the process that went on in your body, you didn't know. The body knows how to do everything from A to Z. So giving birth, your body knows how to give birth very well. Just trust your body and trust your doctor. Your doctor, trust the advice. Anything your doctor says, just follow his instructions and everything will be fine. Okay, so thank you so much guys for watching. Please subscribe, like, and leave a very nice comment. Okay, please join this family. Help me grow, help a sister grow, and let's move forward. I love you so much, and I'll see you in my next one. Bye guys.